Profesor Giuseppe Argenziano jest pracownikiem Uniwersytetu Kampanii w Neapolu i na całym świecie znany jest jako mistrz i pasjonat dermato-onkologii ze szczególnym naciskiem na diagnostykę czerniaka złośliwego. Hello, Professor. It's very nice to have you here.
Thank you for inviting me.
How did your cooperation with our dermatology department start?
Oh, it started exactly 20 years ago. In 2006, we met with Lydia Rudzinska, let's say, during the second consensus meeting on dermoscopy that we organized back then, 20 years ago. And then we met personally in Napoli when in 2006 we organized the first Congress of the newborn International Dermoscopy Society. A long way to go.
And how intensive is this cooperation?
It's very intense because we were part of a group, a working group, for many years in order to establish the basic criteria of this new field of morphologic dermatology. Especially Lydia dedicated her attention to the development of trichoscopic criteria. She is basically the inventor of many of the criteria everybody worldwide use for the diagnosis of hair and scalp disorders, and many other things.
Your primarily field of interest is dermoscopy, isn't it?
Yes.
In which aspects?
Yeah, dermoscopy, it's basically, in my estimation, the biggest revolution that happened in dermatology in the last 30 years. It opened a new dimension for the morphologic diagnosis of skin diseases, not only tumors. By the way, melanoma and skin cancer in general is the main focus, but nowadays the dermoscope became the dermatologist stethoscope.
Yeah, it's a standard tool to work with.
Exactly. And we use it for many reasons, for infectious diseases, scabies, for example, for inflammatory conditions like psoriasis or eczema. Many applications, really.
How does artificial intelligence change dermatology?
There is a lot of things ongoing. Not yet used in the practice, in the real daily practice, but I'm pretty sure that in 20 years, AI will become a good friend, a good alliance in order to improve even more the possibility, for example, to screen lots of people.
Right.
Because we don't have enough dermatologists to screen everybody. While AI could be a triage system in order to screen the entire population.
Okay. You were also involved in something, I found it on the internet, which is called an automated total body mapping.
Yeah.
What is that?
Well, we use a lot of total body mapping, especially for our high-risk patients with multiple nevi, hundreds or even thousands nevi, and in which patients it's very difficult to find the spot, the really suspicious spot, the eventual melanoma.
So many of them, you have to select this dangerous one.
Exactly. And with total body mapping, we compare. We make a baseline examination and then we compare over the years and we excise only the changing lesions. And nowadays, artificial intelligence is taking part of the game because it's helping us to select the changing lesions.
Okay.
Still, there is much work to be done, but it's a nice way to go.
But in which way is it automated?
So there is a software. So since you take pictures of the entire skin of the patient, there is a software which is catching the differences between time 0 and time 12 months. Okay. You know, if the lesion changes, there is a circle around the lesion, and the software is telling you, look at this because maybe this is changing. So for the moment, it's a little bit initial, but as I told you, it will come a time in which you take the picture and the system will tell you, look at these 3 spots because these are the most suspicious ones.
So there will be no examining through dermoscope of individual lesions, but there will be a total body mapping, and the system will
Yes.
tell you this and that is dangerous.
Yes. Or probably you still need to check.
Right. In
but
order to double check.
yes,
Yeah.
to double check. But because usually the analogic view, so your eye, is still quite better than the digital image. But there is a way to go into a faster screening. For example, if you do it by your own, a difficult patient like this one takes a little bit, something like 35, 45 minutes to be screened. If there is a help of an automated system, maybe you need 10 minutes only.
So this is going to improve early diagnosing, as I understand, and prevent the danger.
Exactly, because melanoma is paradoxically a very preventable skin tumor, highly mortal. I mean, the mortality of melanoma is very high, but especially when it achieves a certain thickness in the skin.
Right.
And this takes months or even years in many cases. So
there is time.
There is time, exactly. And so the problem is, of course, not only the problem of making dermatologists able to understand how to recognize it early, but also to bring people earlier at the control.
How widespread is this illness in Italy, and how does it compare to appearance of this syndrome in other countries like Poland, for instance?
I think Poland and Italy are quite similar in terms of incidence of melanoma, despite the fact that you are fair skin, your skin type is very fair. But also in Italy we have a lot of fair skin people, and we have a lot of sun, and
a lot more than we do. That's right.
And still the habit of Italian population is to go to take tan, to become tan. So we have to work a lot to convince them that they have to protect.
Okay, and we are just before holidays, and people would go out and sunbathe, either in Italy, in Poland, anywhere, if the weather is okay. What would you tell them? How should they protect from the sun?
They have to protect with physical clothes. No, I mean, creams are okay. Creams are okay if you go to swim and then you go back in the shade. But if you plan to spend an entire day under the sun, you have to cover yourself, hat, a nice shirt, white shirt, and a little bit of short pants. This is the way the Australians are going to educate their population since 20 years. And Australia is the only country worldwide where the incidence of melanoma is decreasing.
Okay.
So it works.
Because of this...
primary prevention.
Yeah, prevention. Okay. We have 10,000 students at our university, and some of them would probably think about dermatology as the path of their future career. What would you tell them?
Yes, I'm very passionate about residents, about young doctors that I'm personally training for letting them become a good dermatologist. I will tell them, please don't think too much to become a dermatologist to deal with cosmetologic problems. There are so many diseases that you have to take care of. In Italy, this is an issue. Many dermatologists are going into the path of cosmetology, and they don't care anymore of the diseases,
so
of the clinical side.
Diseases, they work with people to help them look nice.
Exactly.
Okay.
So I'm trying to convince them, dedicate to this, I don't know, 1/4, 1/3 of your time, but not more than this. You were studying so many years, you were doing so many hard exams and so on to become a doctor, and then you spend your life in treating wrinkles? No way.
How important is this honorary doctorate to you that you are going to receive in an hour?
Well, actually, I still don't believe it because I mean, this is by far the highest honor that I will receive that I received until now in my career, and it's really something. I have to have time to metabolize and to understand what's going on.
Congratulations, and
Thank
we
you.
are very glad to have you here at the Warsaw Medical University.
Thanks a lot.
Thank you very much.
Thank you.